I'll be inserting and removing a straight catheter for a male. I'll introduce myself first. My name is Olushola, a student note from St. Paul. Then I will confirm the client by using two identifiers. What is your name and what is your date of birth? I'll verify the doctor's orders and ask about the client's allergy. I'll make sure I access the penis when I'm about to insert the catheter for redness, swelling, or break in skin. Then I'll leave the room to go gather my supplies. I'll make sure to have the correct size of catheter and I'll ensure I have a latex free if the client is allergic to latex. If he's allergic to iodine, I'll use cholecystine instead. Then I will, when I return back from gathering my supply, I'll wash my hand and explain the procedure to the client, which is that I'm going to be inserting a straight urinary catheter and draining urine before removing it. I'll then bring a pad blanket and put it on the client to maintain his comfort. I'll pull the one is on down so as to get so that that one can remain clean. I'll ensure I will ensure I will ensure there is adequate lighting. I will then ask the client if it's okay for me to expose her. I will ensure the client is in a supine position, which is gonna definitely help with the drainage of the urine. I will then perform hand hygiene and I'll open the sterile cage using surgical asepsis. I'll remove the first drip and put it on his laps. Then I will remove the fenestrated drip and put it on his penis. I'll be donning sterile gloves before touching the these kits. So before removing the drip or the fenestrated there, I'll have my gloves. I'll have my gloves. I'll have my gloves on. Then pull. I'll pull the penis if it's its own circumstance. I'll pull it down and use the cotton swab to clean from the head to the base using different swab stick. Once using different swab stick, I will ensure one of my hands is clean and sterile. I will ensure one of my hands is clean while doing all the process. So my sterile hand, I will use it to pick up the catheter. I will tell the client he's going to feel some pressure and he should bear down. Then I will insert the catheter in until I will insert the penis to go to the urethra until I see a drain. Until I see urine, then I will insert it 1 or 2 inches more. Then I will allow it to drain. So some facilities do have like how much you can drain at a time. So there is something like that, once I drain to that limit, I'll stop. But if there is nothing like that, I'll wait until I don't see anything again. Then I'll begin to remove. I'll begin to remove the catheter from the penis. Yeah, once I'm done, I'll pack my supplies and equipment and dispose them according to the facility. I'll off my gloves. I'll off my glove, perform hand hygiene, then I'll don another glove. I'll cover the client up Then I'll position him well. I will ensure I give him his call lights. I'll wash my hands again and I'll document what I've performed. Thank you.